Hi, beautiful mamas and mamas to be. Welcome to my channel. Today's video is for every pregnant woman or those women that are trying to conceive. Do not go away because you're going to learn something very beautiful in today's topic. My name is Daisy Peter. I'm a content creator based in Port Harcourt. I'm a mother of 3 beautiful children, and all I teach is healthy pregnancy tips that are based on experience and research. Please still conduct your doctor if need be. I'm not a medical practitioner. I teach based on my personal experience and research. Let's dive into today's topic: the do's and the don'ts of pregnancy, the things you should do and the things you shouldn't do while you're pregnant. Remember, the first trimester of your pregnancy is the foundation of the pregnancy because that is when the child is still trying to develop. So what you do and what you don't do might mar the development of your child or might cause defects in your baby. So stay tuned while I carry you through the do's and the don'ts of the pregnancy journey. I know pregnancy journey can be overwhelming. Every now and then you're hearing, do this, don't do that, but don't worry, it's just for a short period of time. After 9 months, you are going to be fine. Then you can continue to live your normal life. The first trimester in every pregnancy is the foundation of your pregnancy. What you do and what you don't do determine how your baby will look like, will determine how the child you deliver will look like. So you might want to take all precautions, all necessary steps to make your child come out healthy and beautiful. So let's dive in into we'll first of all deal with the do's before you we'll first of all deal with the do's before we get down to the don'ts. So we are going to be taking 5 do's and 5 don'ts. The 5 things you should do while you're pregnant and the 5 things you shouldn't do while you're not pregnant. The number fourth one in the don'ts is very important. Please, you might want to sit down to listen to it. Do not go away. Number one on my list is prenatal vitamins. For those of you that always plan their pregnancy, like so years, so months you'll be pregnant, before you're even pregnant, it is advisable you start taking your prenatal vitamins. But if you just find yourself pregnant, it is also good you take your prenatal vitamins. And what are the prenatal vitamins? You have your folic acid, the bico, the fesolate. All these are very good for the formation of your baby's organ. They are good for iron, they are good for the calcium, and especially folic acid. Research has shown that if you don't take folic acid when you're pregnant, it will make your baby to have neural tube defect. So you might want to take your prenatal vitamins very serious. The number two thing for you to do is to book your prenatal appointment with your doctor. The moment you notice you're pregnant, once it is confirmed that you are pregnant, please book an appointment with your doctor. Do not sit down. Maybe those mother that is their second or third time they are fond of doing that, they will be like, okay, I've been pregnant, this was how I navigated. No, all pregnancies are not the same. So make sure you book an appointment with your doctor. Some do antenatal visit. Go so that they can check your baby, the scans, the lesson, and the tests they always do on you, the urine test and everything will help them to know or detect if there is any issue. And you know that early detection is very important because what is detected very early can be handled. So you might not want to miss your prenatal visit or appointment. Number three on my list is eat balanced diet. Yes, eat food that are rich in nutrient, because if you take food that are rich in nutrients, as your baby's organ are forming, as they are growing, they will form properly, they will form very well. So eat your balanced diet. You have your leafy greens, you have your avocado, you have your egg, you have your yogurt, you have your whole grain. So when you're pregnant, please do not take your diet, do not joke with your diet. Some women after pregnancy they vomit and all that, but you must try as much as you can to eat these things because you're not really doing it for just you but for the sake of your baby. So if you want to deliver a healthy baby, please do not joke with your pre-vitamins. Please do not joke with your balanced diet. Eat healthily. Number four on the list is get enough rest. Your body is really working because you're carrying a baby inside of you. So do not overwork yourself. Please make sure you have enough sleep. For every day, you can have like at least 30 to 1 hour nap every day. It is good for you. Take enough rest because if you stress the baby, if you're stressed, the baby also will be stressed and you might not want to give birth to a weak child. So please take your rest time, your rest routine very serious. And lastly on the do's is educate yourself properly. Pregnancy is a whole lot of journey. It's a journey that you should equip yourself. It's a journey that you should equip yourself with knowledge, the right information, the right knowledge, and please make sure you don't take information from anywhere you hear them. When one is pregnant, you see neighbors, even even nurses, they come to you to tell you this and that. Please make sure you savour every information you hear about pregnancy. Always consult with your doctor before you practice or you experiment any advice that will be coming from families, well wishers, and your friends. So now that we are done with the do's, the things you should do for you to have a healthy baby and for you to be healthy in your pregnancy, let us now go over to the don'ts. These 5 points, do not do them while you're pregnant. Like I said, stay true to number 4 because number 4 is very important. So let's go. Number 1 is, do not smoke or drink alcohol while you're pregnant. These substances are very harsh, they are very strong for your baby. So when you're pregnant, please stay away from harmful substances because they can cause defect to your child and they can also cause miscarriage. Strong drinks and all that while taking consistently can lead to miscarriage in pregnancy. Number 2, don't stay away from raw food, from uncooked food. Stay away from junk because this raw food, this uncooked food carry bacteria, and when you eat them, the bacteria will be transmitted to your unborn child. So please make sure you eat cooked and healthy food when you're pregnant. Number 3, limit caffeine intake. If you're a lover of caffeine or you must take caffeine, please do not take more than 200 milligram every day. So please, you might want to reduce your intake of caffeine because too much of it will cause miscarriage. And number 4 on the list is, avoid high physical risk activities. Yes, some of you like jumping around, riding on horses, doing extremely job or duties. When you're pregnant, that's the time that you want to do the whole chores in the house, moving, carrying heavy objects. When you're pregnant, please avoid these things because if you overwork yourself, you can easily faint or you can easily fall or it can even cause miscarriage. So when you're pregnant, please avoid strenuous activities. I know I said that you should engage in exercises, but that doesn't mean you should do exercise that a normal person who is not pregnant is supposed to do. There are some mild exercise for you to engage in as a pregnant woman. And lastly on my list, do not self-medicate. For any reason, do not self-medicate. Even the teachings you hear online, they are just guidelines for you. After hearing, please go to your doctor. Your doctor should be the one to prescribe. Some of you, because Mr. A told you that when they were pregnant, they had back pain and they took paracetamol, it does not mean that your own back pain is as a result of paracetamol curing. Maybe it's another thing that is the reason for that back pain. So for any complaint, for anything you notice in your pregnancy, please go to the hospital. Let your doctor diagnose you and tell you the right medication to take. Don't go to any roadside pharmacy or don't listen to Nurse Eliza to take any medication. So there we have the do's and the don'ts in your pregnancy journey. Hope you learned something interesting today. Pregnancy is a very beautiful journey, and taking care of yourself during this journey will determine how your baby will come out. And remember, the first trimester is the foundation of every pregnancy. So please take this first trimester very serious. Take care of your body, take care of your baby, adhere to every medical instructions. If you found this useful, please like, comment, and share this to every other beautiful mom, every other trying to conceive mom, that this information will be useful to. Don't be stingy. Don't have this information alone. Thanks for watching and see you in my next one. Bye.